Hi and welcome back to My Anime Clinic. Today we're going to be taking another look at the Dr.Stone anime, but this time it's Season 2, Stone Wars. So a quick recap of Season 1 was that we left SENKU and his group of allies preparing for an all-out war, with SENKU making tools, equipment, and anything that might help give him an advantage over the brute strength of his enemies. Now, in Season 1, I spoke about the creating of antibiotics and the invention of glasses, and if you haven't watched those videos already, I would highly recommend them. But today I want to look at a few more scenes from Season 2 of Dr. Stone, and continuing on our theme of senses from my last video, today we're going to be looking at sound. So much of Season 2 seems to focus around this sense, whether it's SENKU creating a telephone to communicate with his friends, through to utilising music to get his enemies to become his allies. We even see Gen here manipulating his voice to that of Lilian Weinberg to convince everyone that the US is still in existence. We even have a character introduced in the more recent episodes called Ukyo, who has almost superhero hearing. And let's not forget how SENKU uses sound to stun his enemies in the final battle. So welcome, have a seat. Welcome to My Anime Clinic, where we're going to break down some of the medical science behind some of these scenes. Now, it's important to say that we're going to be covering this topic over 2 separate videos, so if you haven't already, please do subscribe to the channel so that you don't miss out on any future videos like this. So this week we're going to be talking about how sound is created in the form of a voice, whereas next week we're going to be looking at how that voice is perceived and interpreted by our ears to allow us to hear things. Alright, let's have a look at today's scenes. Now clearly, sound is a really important sense. Whether you're hearing the voice of a loved one through to listening to music, sound can evoke a very strong emotional response, much like in this scene. But how is the sound of a voice produced? Well, fortunately, I used to work as an ear, nose and throat surgeon, so this is right up my street. Now, we have many examples of where a vibrating object can produce sound, whether that's a guitar when its string has been plucked, or whether it's the membrane covering a drum after it's been beat. But what is it that vibrates when humans produce sound in the form of a voice? Well, it's the voice box that sits in the throat. Now, if you feel the neck, you should be able to feel a hard part in the throat, where there's a bump. This part of the throat is called the voice box or larynx. Try to talk whilst feeling this area and you should be able to feel it vibrate. But more specifically, it's actually the vocal cords that are vibrating rather than the whole voice box itself. Now remember that the voice box actually sits at the top of the windpipe. And so sound is actually produced by the passage of air passing through the gap between the 2 open, vibrating vocal cords. Let's have a look at the next scene. And so in this scene we have SENKU playing the music of Lilian Weinberg, trying to bring their enemies over to their side. But why do voices sound different from one another? For example, when singing? Well, there are several muscles found in and around the vocal cords, and depending on whether these muscles are contracted or whether they are relaxed, will affect how tight or how loose the vocal cords are. Subsequently, this will affect how airflow passes through the vocal cords and thereby affect the sound that's produced or otherwise your voice. Another factor that affects this is also the length of the vocal cords themselves. Let me show you. For example, you can easily demonstrate this with a rubber band. If you stretch the rubber band out and make it thin and long and give it a pluck, it creates a high-pitched sound. Whereas if you leave it short and thick, it creates a low-pitched sound. So it's the difference in these combined factors that go on to determine your unique voice. Now, the vocal cord length in a typical man can be anywhere up to 20 millimeters. Now, if you compare that to that of a woman's, you'll find that the vocal cord length average is roughly 15 millimeters, so there is a noticeable difference. Now, if you were to compare an adult to a child, you'll notice that the difference is even greater, with children's vocal cords being even smaller, which accounts for their tendency to have a higher pitched voice.
つまりね、切り崩すにはさ、司ちゃんに負けない有名人、超カリスマを用意すればいい。Hi, I'm Lillian Weinberg.
So I really love this scene where we see Gen impersonating Lillian Weinberg, trying to bring some of their enemies over and becoming allies. But how do people impersonate other people's voice? Well, it really comes down to nature and nurture. Now, depending on whereabouts in the world you've grown up and what language you speak, your musculature within your vocal cords may be more practiced or more rehearsed at pronouncing different sounds. For example, it's much easier to impersonate the accent of someone who's grown up in a similar region to your own. But another important factor is that of vocal training and practice. As with greater practice, you can gain better control over the muscles that manipulate your vocal cords. Now, really well-trained voice actors have really good control over these muscles that manipulate the vocal cords.
My name is Optimus Prime. I'm from the planet Cybertron.
They also have really great control over other muscles such as the soft palate and the tongue. And what this allows them to do is to manipulate sound even further to either impersonate someone or create a whole new voice altogether.
Sometimes I might bring my voice down like this, and I'll start to talk like Morgan Freeman.
Now, let's say you're someone who's noticed that you've had a change in your voice. Is there anything that you need to be worried about? Well, I get many patients presenting to me with either a sore throat or a bit of hoarseness. And the most common cause of something like this is what we call a viral laryngitis, which is basically an inflammation of the voice box caused by a virus. Now, this tends to be totally harmless and benign, and it tends to improve as your body gets rid of the virus. However, if it persists for more than 3 to 4 weeks without any other symptoms of poor health, I would really recommend you to go and see a doctor about it. Now, back when I was an ear, nose and throat doctor, we used to get many patients sent through with concerns either about a change in their voice or a persistent sore throat with no identifiable cause. Now, in these cases, we would often perform something called NASENDOSCOPY. Now, what this involves is passing a thin camera through the nose, allowing me to have a look at the back of the nose and also down the throat and visualize the vocal cords. Now, a common finding that we would see in professional singers was some inflammation of the vocal cords, and this commonly was as a result of overuse. Now, on the rare occasion we might get a patient come through with a vocal cord nodule, and the way in which we treat this is with a highly specialized laser. We'd be able to burn it off of the vocal cords, with most patients making a great recovery. Okay, well, we've covered the scenes with regard to how we produce sound in the form of a voice, highlighting the importance of the voice box as well as the vocal cords. We've also looked at how, with vocal training and practice, you can gain better control over the muscles that allow you to manipulate your voice to impersonate others. And just lastly, we've spoken about some of the symptoms that can arise if you've had any problems with the voice box and when it might be sensible to see your doctor. Don't forget that next week we're going to be looking at hearing and answering the question as to whether we can develop superhuman hearing. Please don't forget to like and subscribe to the channel so that you don't miss out on any future videos like this. But otherwise, thank you for watching, and I'll see you in the next one. Thanks.